Yes. Hello, all. Good evening to one and all, to all the doctors and students who have joined this session. Welcome to another session of free session. The last time we have done a free session on staphysagria and understanding the deepest core of staphysagria with different rubrics, single patterns, and how a staphysagria patient behaves in the clinic at the male patterns and the female patterns and the pathological prescription as well, and with some clinical tips. And interestingly, I have done one beautiful session, I think on Sunday, that was from International Forum of Promoting Homeopathy. You can type in YouTube IFPH Homeopathy, Dr. Manidrupath. There I have done a session on understanding homeopathic prescription with charts and flow charts of headaches and migraines. So this session is more of such a kind of session which is interlinked. There I have discussed some rubrics patterns with remedy patterns and the genius of understanding each remedy and how to confirm the pattern of patients in your clinic and what questions to be asked and how to confirm. So it is more of same pattern you can see here as well. But today we have come with another topic, that is nail disorders in homeopathy. Just look and prescribe. Next, coming into next session, some important signs about nails. So before going into the understanding of this nail disorders in homeopathy, first we need to understand what kind of nails we have, what kind of behavioral nails at the discoloration level or at the appearances level and at the brittle nails. That is what we are here to understand before entering into the homeopathic patterns. So if the nail pattern is blue, that indicates cyanosis, antimalarial, and hematoma. So here you see blueness indicates cyanosis. So whenever you heard a word of cyanosis and you have seen the blue nails, the remedies comes into your homeopathic pattern are three. One is carbovage, one is camphor, other one is veratrum album. There are many, but these three are high grade remedies. Next, blue green, which indicates pseudomonas infection there. When it is a brown discoloration at the nails pattern, it indicates any fungal infection, staining from cigarettes, or any chemical pattern of gold. And that disease one is Addison's disease. With brownish discoloration, we can think the patient falls into the category of Addison's disease. Sorry, is my voice is audible? Please do text. One doctor has texted that voice is not clear. Is it clear to everyone? Is it audible to everyone? Yes, yes, it's clear. Please do text, please do check your internet doctor so that it will be fine for you. From my side, it's clear. Thank you. Next, coming to red streaks patterns, that is splitting hemorrhages in the nails, that indicates the pathology of infective endocarditis or well as a trauma that you need to understand. White spots, that indicates trauma to nail matrix, not the calcium deficiency. This you need to understand. So generally in homeopathic pattern, if we see white spots on the nails, the remedy we think of is silicea. Right, and that was high grade remedy. If you go into the rubric extremities discoloration white spots, there are many remedies, but silicea is high grade and silicea was given by Dr. Hahnemann. And what confirmatory symptoms we can prescribe to silicea is one thing, perspiration on the palms and soles with white spots on the nails, and very obstinate and timidity nature is of silicea. And silicea people, they never get done feeling. They want to succeed something. They want to show what I am. They are more of ambitious kind of nature. Is silicea. Next, coming into white, brown, half and half nails. This indicates chronic kidney diseases. So in CKD cases, if you are dealing with any CKD cases and having this white or brown half of nail discoloration, the remedies you can think of are three. One is apocynon, one is epis, and the one is L-serum. Epis is thirstless, apocynon is thirsty, L-serum without edema, without swelling, with hypertension. But in apocynon and in epis, there is swelling. But in apocynon, there has a history of alcohol tendency. That are the three quite differences when you are dealing with CKD cases. Coming into the next pattern, that is yellow discoloration, that indicates psoriasis or any fungal infection or jaundice, any tetracycline injections or side effects of the old school dealing with treatments. Next, coming to the next pattern here, yellow nail syndrome. This indicates defective lymphatic drainage and pleural effusions may occur. Next, coming to the last, that is brown longitudinal streak. This indicates melanocytic nerves, malignant melanoma, Addison's disease. So especially of Addison's disease, you think of nosode called adrenaline as your intercurrent, with some indications of adrenaline to be prescribed when the patient has this disease of Addison's disease, and adrenaline works wonders. Adrenalinum, nosode. Next, brown long streak, there is a racial variant you can see in this remedy. So coming into the picture patterns here, you can see this is of more of bluish, right? And then the next comes the bluish gray, green. The next comes the brown and brown streaks. And this picture indicates the red streaks. This is what we have studied. See the red streaks and the splitting hemorrhages. The nail pattern is this. This is the picture. This is white spots, and this was yellow discoloration of the nails. You can take screenshot of this picture, so that could be helpful for you. Now, coming into some causative factors of nail patterns. From hurt is leaden pall. And interestingly, to prescribe leaden pall in any joint pains, joint affections, think the extremities will be cold to touch, and cold amel is leaden pall. And leaden pall is such a remedy can be given, especially elements after any pricking or injection needles is your leaden pall. Next, coming to the next causation here, pricking with a needle under the nail. The three remedies are allium cepa, bovista, and sulfur. So we all know allium cepa is more of hay fever kind of symptoms, which comes very close to euphrasia, right? So in cases of this allium cepa, of your prescribing allium cepa for cold chronic coryza, and there is no results, or you are prescribed euphrasia, but exactly they are falling under these two remedies, but not at all helping, then think of the remedy Gestica atoda. And Gestica atoda is the remedy, is a mixture of allium cepa plus euphrasia. Think of this. And one of the key prescription for allium cepa in Allen's keynote is that shoe bite. In cases of shoe bites, think of allium cepa. And another interesting keynote I want to say you all is for symmetrical warts. Symmetrical warts in the sense at the same line, here is 1 watt, in the same line there is 1 watt. At the same symmetrical warts, there are two remedies in materiamedica, that is allium cepa and syphlinum. But until and unless you get indications to prescribe, you need to prescribe it. Next, coming to bovista, we all know bovista, all the symptoms of puffy edematous swelling. Abuse of cosmetics is one of the key indication of bovista. And one of the key indication I can tell you bovista is for urticaria after excitement, single remedy. Urticaria after excitement is bovista. And even the bovista patients, when they use any scissors, knife of their work, they get the deep impressions on the skin layer. That is one of the key indication of bovista you can think of. Sulfur, it is a huge pattern of polycrust remedy, burning soles, bathing aversion, aversion to sweets, and like desire for sweets as well. So in such cases, you can prescribe sulfur. Coming into causative factors after hard work, rustox and sepia. Rustox, red triangular tip of tongue you can see in acute cases. Sepia, acute prescription always ask for milk desire for or aversion. Sepia patients almost the aversion for milk, especially cold milk. Cold milk causes diarrhea for sepia patients. And sepia patients love bathing. That is key confirmatory of sepia. Next, pricking near the nail is iodatum, that is iodum. Next, causation factors at the splinters, that is beretta cup, heparsulf, iodum, lacasis, nitricum acidicum, petroleum, silicia, and sulfur. Next, splits of the skin adhering to the nails, that is allium cepa and nitrum mure. Next, this is what a very important thing is, blood around the nails, single remedy epis. As I said, epis is thirstless remedy, especially used in CKD cases, and epis has a jealous nature, especially women's jealous with lot of burnings. You can think of epis. And epis is also a wonderful remedy for right ovarian cyst until and unless it is indicated. Don't prescribe just for right ovarian cyst. Next, coming to the next remedy, blood around under the nails, that is hemorrhagic pattern. The remedy is Crotalus horridus. Lot of blackish hemorrhagic diathesis you can see in this remedy. And one more keynote prescription I can say about Crotalus horridus is in cases of dengue cases where the blood platelets are coming down, start Crotalus horridus 30 c with low potency every 1 hourly, repeat for 24 hours. Patient blood platelets will increase. And I did almost all dengue cases of blood platelets to increase within span of 1 day or 2 days. The rescue remedy is Crotalus horridus. Next, offensive saniculous discharges in Okayam. The remedy is lachesis. Lachesis also have jealous patterns. Lachesis also have suspicious and fear of snakes. And lachesis patients are more of beauty kind of nature. In your clinic, a lady comes with almost all wearing all the gold ornaments, lipsticks, very beautiful looking, very glorious looking. You can think of lachesis there. Settle under fingers and toes nails with cold limbs. That is epis. So these are the charts. You can take the screenshot, which was done by my team. Thanks to them. See this injury at the matrix level, that is hepars. Pain at the root is sulfur. Blood under the fingernails is epis. Oozing from the fingernails is Crotalus horridus. This is the quite difference you can see in this remedy. So this is a picture for the blood under the nails, while prescription you can think of. So all these observations come into rescue in your acute cases as well as chronic, but in acute, these plays huge role in differentiating the remedies. Next, coming to the pattern of brittle nails. In cases of brittle nails, think of alumina, umbragracia, castor aqua, diascoria, graphitis, and thuja. So graphitis, thuja is more of polycrust remedy. In depth, we need to understand it. But aluminum prescription, always think of aversion to potatoes. And there is one beautiful rubric is that delusion mind not belongs to me. Aluminium is a like robot kind of nature. They are of more of confusion mind. They depend on someone. For any decisions they take, they need to depend on someone. No self dependence, no way of thinking, lot of confusion you can see in alumina remedy. Umbragracia, one of the remedy for business loss is umbragracia. And in family history, when you take a case and patient says, doctor, there are a lot of frequent deaths. My father has died last 1 month back, then 3 months back my grandfather has died, then 4 months back my grandmother died. Due to all these complaints, now my health is deteriorated, doctor. So umbragracia, continued deaths in any family patterns, think of umbragracia. That is one of the causative factor for umbragracia prescription along with the indications. Brittle nails and a fingernail, the remedy is sorinum and silesia. Sorinum at last most hopeless for discovery. You can see recovery. You can see it's more of sulfur kind. When your well selected remedy fails to act or regain the vitality, you can think of sorinum. Lot of offensiveness in this remedy. Next, brittle skin of tip of the finger with, that is alumina again. Brittle nails, lacinating pain in fingers with tendency to ulcerations. With lot of ulcerations with brittle nails, think of alumina. Brittle toenail, especially large toenail, that is castor aqua. Next, brittle nail with soft and elastic later on. The remedy is umbragracia. Next, brittle nail, cracked nails, almost cracked nails is single remedy nitromure. And cracked middle lip is nitromure, because in nitromure it has lot of dryness like bryonia actually. Lot of dryness you can see in this remedy nitromure. That's why they develop these cracked nails of nitromure, and especially mucocutaneous junction membranes are dry in nitromure. Elements from disappointment of love. And nitromure, one of the keynote prescription you need to observe in nails is hanging nails. Hanging nails is nitromuricum. Is it clear? Is my voice is audible? Is it going fine from your side and from my side? Please do text so that I can proceed further. Please do text. Yes, yes. Thank you. Fine. So in case of crippled nails, the remedy is causticum, graphitis, sabadella, and thuja. Here you see causticum is a remedy. Elements after burns, we need to understand more of causticum. But see, in-depth understanding of remedies is much more needed now I'm giving the gist to understand you at the confirmatory symptoms level. And injustice cannot tolerate is causticum. Yes, yes, I will discuss about this magnet remedies as well. I have added one rubric of that. I will discuss. Your questions, please post it down at later, doctor. Next, causticum, as I said, injustice cannot tolerate elements from burns. You can see a lot of sympathetic nature you can see in causticum. That is one of the most important remedy. Care, worries of others comes very close to cocculus. And causticum, phosphorus, nitric acid. These are three metromedical remedies which have sympathetic nature. Graphite is to be prescribed at cripple nails. They need to have smallest, slightest trifles aggravation is graphitis. And any skin disorders having honey sticky discharges is graphitis. Sabadilla for hay fever, especially aggravated in the morning, you can think of sabadilla. Fingernails brittle is Cilicia. So this is what you can see. These are the brittle nails pictures. Especially these pictures, you can understand the appearance of brittle nails. Now the beauty comes here. Especially if you see a patient with shiny nails, lot of shiny nails, the remedy is tuberculinum. And this was the keynote prescription for one of the great eminent homeopath P Shankaran sir's prescription. And in his book he has mentioned that shiny nails, always if you see any shiny nails, directly prescribe tuberculinum, works wonders with a history of tuberculosis in the family. And here you see tuberculinum and tarantula comes very, very close. Both having restless, both are very well in children's cases, ADHD, restless, overstimulation of nerves. Everything will be very, very close in tuberculinum and tarantula. But the major difference is tuberculum aversion to music, aversion to dance, but tarantula loves music and dance. That is the quite difference between tuberculinum and tarantula. Next, carcinosin. See, carcinosin people, they tear the nails here around this. In this pattern, they start tearing like this. That is a picture, and that indicates carcinosin well. Tears himself skin around the nails. That is the key confirmatory of carcinosin, especially in children's cases. And parental domination, strict parental domination, you can see in carcinosin. With cancer history of family, and carcinosin people are a lot of artistic people, draws for diagrams, etc., pictures. That is the key indication of carcinosin. Coming into biting fingers, especially in sleep, is elapse. And I will tell you one beautiful key prescription for elapse. Whenever to confirm elapse patient, ask for desires for buttermilk. Especially cold buttermilk is elapse, like Talapsi bursa pastoris. Comes very close. Buttermilk desires, elapse, and Talapsi bursa pastoris. Biting fingers with bleeding, that is aurum trifilum, which is very good remedy for pharyngitis until and unless it is indicated. Next, biting fingers at the tips. At the tips, they start biting. That is carcinosin. Now, see this, extremities, depressed nails. If they have depressed nails, the remedy is medorinum. And medorinum is a nosode. It is a mixture of some polycross remedies. And medorinum key indications are having history of UTI, you can think of this remedy, and almost all lot of cravings. If a patient describes you hundreds, 50 or 20 cravings, doctor, I like pizza, doctor, I like pani puri, I like sweet, salt, anything is okay. I am more of eating kind of person. Then medorinum. Medorinum has highest cravings in Metromedica. And they desire for ice cubes, especially at the pain. In the kidney region, they have pains, then they desire for ice cubes. The single remedy is medorinum in Fatak Metromedica and medorinum sleeps on abdomen. Lot of laziness, lot of procrastination you can see in this remedy. Many more you can think of medorinum. It is a huge remedy. We'll be discussing some polycrust in our coming sessions as well. These are the gist for you all. Next, this is what one doctor has asked. See, ingrowing toenails. Ingrowing toenails, especially in children, the remedy is Cilicia. Understand this. Ingrowing toenails with lot of granulations and unhealthy. Think of lachesis. Is my voice is audible? Is it going clear? Is it fine from my side? Yes, yes. Thank you. Thank you. So in cases of ingrowing toenails with a lot of granulation, which is unhealthy, then think of these remedies three, that is lachesis, sanguinaria, and magnus pol astris. This is what doctor has. And lachesis, we already discussed. Sanguinaria canadensis is such a remedy you can think of with having climatic disorders very close to lachesis, and headaches, especially settle on the over of orbit of eyes. And sanguinaria canadensis is very good remedy for frozen shoulders, especially of right sided. With left sided, it is ferromate. With right sided, it is sanguinaria canadensis. That is quite good difference you can think. Next, ingrowing toenails with paralysis in. The remedy is alumina. Ingrowing toenails with a lot of ulceration. Nitric acid, lot of burnings you can see. Affection of mucocutaneous junctions. Lot of revengeful kind of nature is nitric acid. Silicia and Trucrum marum virum, which is a very beautiful remedy for nasal polyps. Actually, I never get results with Tucrum verum with nasal polyps, but Nash has mentioned to give in 50 m potency for especially in nasal polyps. Next, in growing toenails, inner side of first toe. In growing toenails, inner side of first toe, the remedy is Magnus pol astris. Now comes a beautiful clinical tip is that in cases of ingrowing toenails, where you have given silicia, tucrum verum, floric acid, where your well selected remedy is not at all helping, think of this remedy, Magnus pol astris. Try to read it from Clerk Metramedica. You will get a beautiful indications and a beautiful remedy in prescription of ingrowing toenails. Refer in Clerk Metramedica. Next, nails crushed grow in splits. Dosage and repetition, I usually have to, I prescribe in low potency, 30C, frequent repetition, and I prescribe especially water doses. I never follow for dry doses. I prescribe in water doses. What Hahnemann, Master Hahnemann has mentioned in our Organon 6th edition. Next, coming to next, that is nail crushed, grow in splits like warts, antimonium crudum. For antimonium prescription, lot of harness spots you can see. How much the thick is, the more indicated is antimonium crudum. They desires for pickles, lot of desires for especially for Indian pickles. And antimonium crudum is a remedy for warts, we all know, and impetigo with lot of skin ulcerations. And one of the key indication of antimonium crudum is especially in disappointment of love. There are a lot of disappointment of love you can see in antimonium crudum, which is more of high grade than nitramur or ignitia. Fatak mentions only two remedies in love sick, that is antimonium crudum and Tilia europea. In antimonium crudum, they even don't have the thought of having eating food, thought of having going to urination. Such a brooding thoughts, such a brooding of disappointment you can see in antimonium crudum. Next, take this as your screenshot for your prescriptions as well. For biting nails, there are some remedies we have mentioned. For especially for black nails, arsenic, graphite is leptendra. Leptendra is also having stools black as well with nitramur. Brittle nails, the remedies we have mentioned. With crumbling nails, the remedies we need to think of is arsenic, sepia, silicia, and thuja. Arsenic is midnight aggravation, midnight restlessness, soul cracks. You see a case having these crumble nails and having soul cracks and whatever the pathology, and the pathology is aggravated at night. Blindly sure shot arsenic will work. Soul crack is arsenic. Yes, what is the causation for blackness? That could be any hemorrhagic tendency or any physical injury where blood has clotted. You can think for that black nails. Next, curved nails is nitric acid. Creeped nails is arsenic, causticum, graphite is nitrum ars. Nitrum like a grief, nitrum like disappointment, arsenic like restless, arsenic like anxiety. That combines a beautiful picture of nitric arsenicum. Nitric acid, sabadilla, sepia, silicia, and thuja. Next, this is also you can take screenshot here. Homeopathic insights for nail pathology chart. Under the nails, there are some remedies. Doctor, I will ask you, sorry. Please keep your questions at the last. Surely I will ask you. Next, under the nails, that is aluminum, causticum, and coccus cacti. Coccus cacti is a remedy for cough, for respiratory troubles, until and unless it is indicated. Sulfur, beginning of the root, causticum, and graphite is you can think of this remedy. Pain under the fingernails, bismuth and berries. See, this you need to understand. Before suppuration of any nail pathology, you can think of hepar sulf and silicia. After suppuration, silicia and sulfur. And these charts will be available in my WhatsApp groups. Those who are already in our WhatsApp group will be sharing there. Those who are not there, they can join. At last, we'll be sharing the link as well. Now coming into the interesting pattern of understanding the remedy patterns here. Lines and indications. Ridges can signify as possible infections such as flu. Bouillon's lines. Transverse depressions you can see occurs when the growth at the nail root matrix is interrupted by any severe acute illness. When you see transverse lines at the nails, then you can understand the pathology they are suffering with is heart attack, measles, pneumonia, or fever. These lines emerge from under the nail folds weeks later and allows us to estimate when the patient was sick. So the rubric for this is nails coagulated transversely. Only two remedies in whole materiamedica and the repertory as well. The two remedies are arsenic and medorinum. We already differentiated arsenic and medorinum as well. In that differentiation, you can prescribe a remedy that is single remedy which matches the patient. So this is what the pattern you can see, ridges. A lot of ridges you can see. The ridges are longitudinal, fluoric acid, and calipos. But the ridges are transverse, it is arsenic and medorinum. So fluoric acid is more of a remedy for sexual excess. Lot of fluorine-like symptom, that is aversion to their own family members, indifference to own family members, mingles with a lot of strangers. Calipos, more of family-oriented, we can think, and we have done a beautiful session of almost all 15 Kali salts, beautiful prescription of 600 slides of Kali prescription. We done that session. It was already completed. Those who are interested, they can DM us. This is the understanding of these Buis lines. That is what I said. And this is the clinical appearances you can see. Next, coming to me lines. These are transverse white lines that run across the nail, following the shape of the nail of moon, that are uncommon. So what was the causation for these me lines? After acute or severe illness, even especially for arsenic poison. That's why arsenic alb is very, very much indicated in Me's lines. These are some confirmatory symptoms you can prescribe, or you can search for prescribing arsenic. You must observe. This is the acute observation, which is most important for an homeopathic practitioner. This is what you can see, the lines very clearly. The picture you see in the A pattern and the B picture, see the lines. See it here. This is what. Next, coming into vertical ridges. Lengthwise grooves or ridges may indicate a kidney disorder, that is kidney failure associated with kidney failures associated with anemia or iron deficiency. They have this observation of vertical ridges in the nails and may indicate a tendency to develop arthritis. Beautiful. This is a beautiful understanding of each remedy and observation. Nails, roughness, fingernails, ridges longitudinal, that is fluoric acid, as I said. Nails, roughness, fingernails, ribbed is Thuja. Thuja is such a remedy you can prescribe. The key confirmatory of Thuja is perspiration with a lot of eruptions, aversion to onions, at the same time the desire for onions. And Thuja meadow comes very close, very, very close. But the major difference you need to understand is Thuja doesn't have aggravation or amelioration at 5 p.m., but meadow has. And Thuja desires for tea, especially tea, and extra hair growths is Thuja, and especially warts is Thuja. Nail cognated are arsenic, calcarea floor, lot of hardness, hard tumors, fluoric acid, medorinum, phosphoric acid, Phosphoric acid key confirmatory is ask for fruit desires. And if patient says, I desire for fruits, then you ask, do you eat fruits or do you like it more of juicy kind of juice making it? Doctor, I prefer to have juicy rather than eating fruits. Then he or she is phosphoric acid with other confirmatory symptoms. Sabadilla, selenium, lot of importance with lot of weakness, especially at the old age. Silician thuja. These are the picture for vertical ridges. Next comes the nail shape, that is clubbing fingers. So before going into this, understand this picture. These are the clubbing fingers. This is very, very important in pathological prescription cases. See this picture, clubbing. So fingertips widen and become round. Nails curve around your fingertips, more of convex. The convex nature you can see. Proximal nails fold feel spongy, caused by enlargement in the connective tissue as compensation for a chronic lack of oxygen. So in almost all cases of emphysema or COPD, lung diseases, where the COP would, where the partial blood oxygen level is dropping down, in such cases, first you need to observe there is any clubbing of, there is any clubbing of fingers you can see. If there is any clubbing of fingers here, then you can prescribe based on this pathology with symptoms matching to it. Chronic lung diseases, chronic bronchiectasis. I will tell you one beautiful clinical tip for you all. Especially in old age cases, old age people who are suffering with chronic bronchiectasis and their fingers are clubbing, the two remedies come into the rescue is until and unless your well selected remedy fails, then think of these two remedies. One is hypoxinum. Hypoxinum, it's a no-sode. Other one is ammoniacum. Hypoxinum and ammoniacum. Refer for boric materiamedica. There he has written that is chronic bronchiectasis in old age peoples. Hypoxinum and ammoniacum. For adults, it is antiemtot. Understand this. For adults, it is antiemtot. For old age, it is hypoxinum and ammoniacum. And heart diseases, long-standing TB, congenital heart diseases, cyanotic and primary biliary cirrhosis, you can see in this remedy. The remedies are medorinum, nitric acid, and tuberculinum. With curved fingers, with lot of lung infection, with lot of respiratory issues. This is the picture for you all. This is the picture. Now, coming to pitting nails. Small pitting or depressions. Most common nails problems seen in 25% to 50% people who suffer with psoriasis. Who suffer with psoriasis. This is the beautiful understanding we made for you all. Whenever you are dealing with any type of the psoriasis cases, understand if they're having the pitting nails. Extremities, nails, holes is arsenic. Is arsenic. Psoriasis, there is a lot of pitting and oncolysis you can see in this remedy with a lot of thickening and lot of yellowish tan discoloration. It is more of oil spot lesion. This is what? This is the picture. See here, it is more of oil spot lesions you can see in this pitting nails. And these nails is especially found in the pathology of psoriasis. Next, coming to the next, that is spoon nails. Soft nails that look scooped up. Depression is usually a large enough to hold a drop of liquid, often indicates iron deficiency anemia. Extremities, nail complaints, depressed is medorinum. As I previously said, this is the same. They are more of spoony nails. This is the picture you can see in this. Lot of spoony nails with having a history of iron deficiency anemia, with having a history of medorinum like complaints, past history of frequent UTI, or present history of recurrent renal calculi. Medorinum is your remedy. Or you have the suppressed gonorrheal symptoms. Next, coming to oncolysis. Lifting of the nail from the nail bed is called oncolysis. The causes for this are, one is trauma, other one is psoriasis, any drug reactions. Like any old school homeopaths having some medicines reacted to that, they can have developed this oncolysis. Bacterial and fungal infection, contact dermatitis from using nail hardeners, thyroid diseases, iron deficiency anemia, or any syphilis diseases. My dear doctors and students, this is for you all. This indicates the pattern of understanding case taking. Usually, I do this in my clinic. When your case is well taken, absolutely taken, then your remedy will be never go for wrong prescription. In almost all my cases of my acutes, I see for tongue, I see for nails, I see for build, I see for gait, I see for gestures, how he's speaking, what he's speaking, the way of speech. These five are most important for your acute prescription as well as for your chronic prescriptions as well. Understand these patterns. Loosening fingernails, Apis medorinum, pyrogenum, and Eustilago. Eustilago is a more of fungal remedy with a lot of sexuality you can see in the remedy Eustilago. And this remedy works wonders with lot of sexual desire and having a female pathology of endometriosis or any fibroids. Infertility cases where the fallopian tube is blocked with a lot of sexual desire, having fungal like sphere of action, fungal like themes, Eustilago works wonders. Pyrogenum, especially in cases of fevers, which is not getting down with any antibiotics. The fever is showing up spikes at 100, 1, 1, 2, 101, 102, 103, not at all coming down. Then give pyrogenum 30C, low potency, frequent repetition. And this has been helped in almost all ICU cases, which I did in my clinical experience of right brain stroke, left brain stroke, where the fever is not at all coming down. You can think of pyrogenum. This is the healthy nail. Understand the pattern. This is the healthy nail and this is ankylosis. The nail affected by fungus. This is the picture. Coming into nail growth patterns. If nail growth is hypertrophy, thickening of the nail either congenital or acquired, the nail become deformed with claw-like appearance. Cause not cutting the nails, trauma, leprosy, or peripheral vascular disorders. So in cases of nail hypertrophy, the high-grade remedies are calcarea floor, fluoric acid, graphitis, and laurocirrhosis. Laurocirrhosis with nail hypertrophy with heart complaints. Graphitis, nail hypertrophy with lot of trifles, lot of anxiety, and having skin pathology. Fluoric acid having caries of bones, long bones affections, syphilitic tendency of rheumatoid arthritis. With fluoric with fluorine like mind state, acid like loss of vital fluids, lot of weakness. With hypertrophy, think of these remedies. This is the picture. Nails atrophy. The nail become thin, rudimentary, and a smaller size, either congenital or acquired. The causes can be lichen planus. And lichen planus, I said, right? One of the beautiful remedy in materiamedica, where lichen planus, when your well selected remedy fails to act, think of the remedy sulf-iodatum. Sulf-iodatum. Boric has written first paragraph of Boric, obstinate skin affections. Then in such cases of lichen planus, you can think of the remedy sulf-iodatum. Nails atrophy, it is silicea again. Nails grow but do not, like antimonium crudum, pituitarinum, radium bromide. Radium bromide joint pains amel by cold applications. Think of this remedy. Next is silicea. This is a picture for nail atrophy. Next, nail patella syndrome. A rare genetic disorder occurs in 2.2 out of every 1 lakh or 1 crore people. Causes abnormalities in the bones and nails. Autosomal dominant, you can see, carried by the ABO blood groups. So such nails present as small and concave, longitudinally grown, abnormally split, pitted, and softened, discolored, you can see, or brittle. The remedies comes into the rescue are thuja, graphitis, calcarea floor, and syphilinum. Syphilinum, almost all night aggravation you can see, and syphilinum patients are self-destructive and having a family history of alcoholic tendency, hereditary alcoholic tendency, lot of washing mania, OCD is syphilinum. And syphilinum is one of the beautiful remedy for congenital anomalies. Like I will tell you example. If 1 ear is small, 1 ear is large. if the nail fingers are 5 and the nail fingers are 6. Almost all congenital anomalies, the first remedy you need to prescribe for the patient is syphilinum. Syphilinum. Understand this. Even medullinium also have these congenital anomalies, but syphilinum is a high grade remedy. Hands, nails, fingers generally grow nails but do not. Antimonium crudum, calcarea, and silicea. This is what the figure for nail patella syndrome. Now coming to discoloration in lensin nails, that is half and half. So when you see this appearance, if you see this appearance, this is lensin appearances. This is the lensin appearances. If you see these kind of nails, then that indicates a chronic kidney failure. Chronic kidney failure. Look for an arch of brownish discoloration. See this. This is the arch here, you see beautifully. This is the arch of brownish discoloration. Here also brownish discoloration. That indicates CKD cases, almost all chronic kidney failures. Internal diseases and nutritional defects you can see can cause changes in the appearance of the nails. Next, hairy nails. The nails look opaque and white, but the nail tip has a dark pink to brown band. See this. This is the pattern. This is the pattern of hairy nails. What was written here? Once again, I'll go through. White, but the nail tip has dark pink and brown. See this. White at the tip, and the nail tip you see it is brown or pinkish. Here also you see white with a nail tip with brown and black. This is what the other thing here you see at the toe. This is the picture for you all. And what it indicates actually, any cirrhosis, any congenital heart failures, adult onset of diabetes, and especially think of diabetes, right? And cancer and aging. Now coming to the next pattern is cyanosis. A bluish discoloration visible at the nail bases in selective patient with severe hypoxemia or hypoperfusion. So especially in almost all bluish discoloration cyanosis, veratrum, camphor, carbovage, and hydrocyanic acid. These four works wonders. And you need to differentiate actually. Because carbovage is one such a remedy for almost all this cyanosis, because boric or many masters has mentioned that disintegration of oxidization, disintegration of circulation is carbovage. And almost all never well seen any particular diseases think of carbovage. Think of carbovage. Carbon group is more dependent on parents. Father attachment is more seen in carbon, and mure attachment is more seen at mother's level. And we done a beautiful session of carbovage, which was already uploaded in my YouTube. You can join there and subscribe. You can watch it. This is what the cyanosis you can see. Next, paranchonia, that is phelons. Inflammation of the nail folds, which appear red, swollen, and tender. The cuttle may not be visible, but the causes for this are fungal infection, secondary bacterial infection. People whose hands are often in water are more susceptible. So for laundry workers, for patient who having this washerwomen's like sepia, washerwomen's remedy, continuously they dip their water. So they are more prone to these paranchonia, that is phelons. And in phelons cases, almost all the remedies works are silicea, heparsulf with lot of pus discoloration, with lot of offensiveness. And the other remedy you can think of is anthracinum. When your heparsulf and silicea fails, anthracinum comes into the rescue with lot of burning like arsenic, nitramine like mind state. That is anthracinum. And myristica is also works wonders with this fungal infection when your heparsulf and silicea fails. It was written in boric at the last line. When this remedy fails, you can think of myristica. The other remedies you can think of is the remedy is gunpowder. With a lot of blackish discoloration, you can think especially gunpowder with lot of granulation ulcerations, with lot of phelons. You can think of. That is what here it is. See, myristica was there, silicea was there, heparsulf is there. This is the beauty of understanding. Tarantula cubens, as I said. And these remedies works wonders in abscess, carbuncles, boils, any skin infections. But you need to have some indications of each remedies. Nail pulp of the nails recede, leave raw surface, sickle core, especially in gangrenous cases with diabetes. Redness at the fingernails, epis, arch, cortisone, crotalus scleratus, as I said, lithium cup. Lithium cup is wonderful remedy for kidney stones, especially of right-sided. Ozone. Ozone, one of the beautiful indication which I learned from Dr. Sarkar sir's book, that is ozone backache. Backache, especially at the backache, at the lumbar region spine, and they feel they want to have desire to be alone. That is ozone. X-ray. X-ray works wonders in almost all cases. And whoever are in my paid group of Kali session groups, I shared this PDF of X-ray, which was written by SP Day. Beautiful booklet of X-ray of 48 books. Wonderful description of X-ray you can see. Inflammation of fingernails around conium, Helleborus, cola, nitramure, nitram sulf, phosphoric acid, and silicea. Conium, old age remedy, lot of vertigo you can see in this remedy. Helleborus is an insanity remedy, more of mind state remedy. Nitram sulf, nitram like grief, nitram like disappointment, sulfur like egoistic, sulfur like embarrassment elements from sulfur like philosophical mania. And nitram sulf is one such a remedy. You can think of this inflammation of fingernails when patient is constantly working for years together in damp wet weather under cement on the floors. Who works for the cement workers? Who works for the buildings? Nitram sulf is one such a remedy. And in such damp weather, they develop asthmatic complaints. Psychotic asthmatic complaints is nitram sulf. The next rubric, hand nails, finger general inflammation, fingernails at the root is heparself and sticktopy. Sticktopy is one such a remedy you can think with a history of hay fever and lot of coryza. And sticktopy is also a remedy for rheumatism of neck, like Lacnanthus stechura. And another key inflammatory symptom of sticktopy is sleeplessness after post-operative. Post-operative, they develop lot of sleeplessness. Then think of sticktopy. But the first remedy you can think of always all at the post-operative is staphysagria. This was the picture. This is the ringworm nails. Next, splinter hemorrhages. Looks like a splinter underneath the nail, virtually 100% diagnostic of subacute bacterial endocarditis. This is beauty. That is what I already described. Splitting hemorrhages. If there is any splitting hemorrhages, the nail patterns of these indicates for sure an endocarditis, for sure in heart troubles. There are many remedies here. Ars iode, kali iode, syphilitic remedy, bismuth is there, spigelia is there, heart remedy, naja is also there, spongia is also there. So more of action of such endocarditis. This is the picture for you. Absent half moons. If there is absent of half moons, then the pathological prescription is pituitary problems or poor circulation. That is nails luna absent, lyco, pulsatilla, tuberculinum. Only three remedies. Lyco, dictatorial, want for power. One of the key prescription I always ask for lyco patients is heels are cracked. One thing. Next thing, warm food desires. Warm sweets desires is lycopodium. Fear of responsibility is lycopodium. They are dictatorial, want for power, but at the same time, they have this cowardness nature. Very, very greedy nature like arsenic. Very greedy. Next, white hus at the base of nails. Liver diseases like chronic hepatitis or cirrhosis you can see. Yellow nail syndrome, I already discussed. That is what? Yellow nail syndrome is characterized by yellow or greenish nails at the lack of cutil and grow slowly and are loose or detached by oncholysis. May be associated with swelling of hands and feet. That's why it is one such a remedy for chronic bronchiectasis. A lot of respiratory disorders, a lot of lymphatic system. When cancer cases, when there is enlargement of the lymph nodes, they develop these yellow nail syndromes with diabetes and liver disorders. So here the remedies also having the same action actually. Naxomica, sulfuric acid, Merxol, lycopodium. Carbovage. This is a picture for you all. Yellow nail syndromes. White spots, as I said, silica is top remedy. Always think of white nails, white spots nails. This is the picture. White spots nails, pakka confirmatory is silica. If you find it, you prescribe silica, it works wonders. Melancholia, vertical pigmented bands or nail molds. A sudden change in the nail plate could could indicate a malignant melanoma or lesions. So when there is a melanoma deficiency, you can see this. White is discharge. White is discharge is melanonia deficiency. This is the picture. Next, brittle nails we already discussed. So one of the pathology you can think of brittle nails is at the state of hyperthyroidism as well, with a lot of concave like spoony nails. Brittle nails indicates iron deficiency, anemia, kidney and circulatory problems. The high grade remedies are sorinum, graphitis as well. Nails that chip, peel, crack or break easily suggest a nutritional deficiency, lack of hydrochloric acid, protein or minerals. The remedies antimonium crudum, arsenic, lacasis, nitrosamine and silicia. Crumbling away of fingernails, butyric acid, a volatile acid obtained from butter actually. Nails scatter like powder when cut, silicia. Such a brittle you can see in this remedy. This is splitting nails. This is peeling nails. Now at the end, the summary. Liver diseases, take this as screenshot. Liver diseases, white nails is indication. Kidney diseases, half of the nail is pink and half is white. Heart conditions, nail bed is red. Lung diseases, yellow discoloration of nails. Anemia, pale nail beds you can see. Diabetes with lot of yellow nails with slight bluish at the base. Some nutritional deficiency you can see, vitamin A and calcium deficiency, dry brittle nails. So if you see a patient having dry brittle nails, try ask for them have a test for vitamin A and calcium deficiency. If they have vitamin B deficiencies, horizontal vertical ridges that break easily. So in such homeopathy should work. So if this is deficiency, here you have given brittle nails, arsenic was given, but their vitamin A and calcium deficiencies are low. Your remedy may work, but the recurrences occur. That recurrences should be corrected with their diet. So you must have a knowledge of prescription at the same level. You need to give dietary regulations and patterns to the patient. Vitamin B12 deficiency, dry dark nails with rounded and curved nails you can see. Protein deficiency with lot of white bands. So thank you. And what I was about to say is we are coming up with a deep dive into polycrust remedies. 6 polycrust remedies we are going to discuss from which is starting from April 1 to 30. Along with that, 50 important mind rubrics and pathological prescription rubrics with the decoding of insights, understanding of Fatak Medica as well. Whoever already was in our group, they know what remedies, what rubrics I have gone through. And you can ask group, I will share some feedbacks of our previous sessions as well. 50 rubrics, everyday case discussion, everyday materiamedica discussion with clinical tips, both lot of clinical tips with discussion. Total 6 remedies. One is abrotinum, aconite, alumina, ammonium carb, anacardium, and anacardium occidentale. Early bird offer is running for you all. You can register with 599 and 3 months of access will be given for you all who have joined this. Every day we will be discussing a lot of cases, different repertories with live cases as well from my clinic. And those who are not there in our groups, they can join my groups. These are the scan. If you scan it, you will having my WhatsApp and my WhatsApp channel and YouTube as well. So you can ask your questions. You can shoot out your questions. We have a discussion here. And everyone, please share your feedbacks in the groups. Whatever you are present, please share your feedbacks. Join our groups. Learn with us. Yes, now you can ask the questions. Yeah, shoot out your questions so that we can have a discussion. Okay, image was yeah. Can you describe the complaints what patient is suffering with, so that we can understand the exact pathology and of understanding. The image which was forwarded by Dr. Monica, I think. Next, sir, will you please throw some light on fungal diseases in nails? Sure, sure. We'll come up with next sessions as well. If there is no other symptoms, as discoloration is there, doctor, but you need to understand why the patient has come for you, for what reason he or she has come for you. So based on the chief complaints, you dig the case taking, and you understand when this discoloration is started, like when it is started. Is there any physical injury? Is there any physical trauma? You need to understand. So based on that, the case taking open ups. Then we can prescribe actually. I think there is some disease pattern of kidney or any heart problems that you need to understand. Yes, cosmetic is reason. If that is cosmetic is reason, then go with Bovista 30C. But you need to confirm some Bovista symptoms. If the face is very puffy, edematous swelling is there of Bovista. But cosmetic elements from, if it is sure doubt, if it is cosmetic, Bovista works wonders. Remedy for thrombing pain around the border of nails, aggravated when coming into contact with water. You can think of sepia, washerwoman's remedy, sepia, and you need to understand amylation factors as well. And water, is it hard water or soft water? That you need to understand. Difference between ringworm infection and oncholysis. It was same, doctor. It was same, but the terminology is different actually. Yes, please mention the other way of making payment than scanning. Payment scanning, you can text me, doctor. I'll just send you. This was the payment details for a while. Yes, I will send you the payment details. You can text me. This is my WhatsApp number actually. Yeah, this is my WhatsApp number. You can text me. I'll send the payment details as well. And we already done Kali Sal session and Constitution session, rare remedies of 50 rare remedies. We already discussed. The recordings also available. Those who are interested, they can. And for more my videos of on Staphylococcus aureus, carbovage, understanding of medica, constitutional appearances, understanding of guacam remedy, auramure remedies, which I already posted in my YouTube channel. You can go and watch it there. Please share it, and you can subscribe our channel. We'll be coming up with more such remedies very soon with you all. And please, each and everyone, please share your feedback in the group. That will be helpful for us. I did not understand, doctor. Aggravated water. Yeah, that's what I'm saying now. Water aggravation. You need to understand actually what kind of water they are using, or they are using any detergents while washing it. That could be the reason as well. CPI, you can think of CPI actually, washerwoman's remedy. Yes, please take a class on tongue color and remedy. Yeah, we'll do it. We'll do it, doctor, in my coming sessions. With your all your support, if your support is very well, we can proceed with lot of free sessions. What my guru, which I learned from my guru, he also shares with lot of enthusiasm, with lot of very minimal fees. That is what we need to, as a student, we need to replicate the same what my guru has followed and what my guru has shared with us. So please share your feedbacks. Will surely look after your doubts. You can text me in my WhatsApp. Will look after your doubts. Please, each and everyone, please share your feedback. That will boost up for me, and you can join our WhatsApp groups. Everything is in this link. Please do subscribe. Thank you so much for you all.